Hello and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Prenatal diet that meets dietary guidelines may reduce risk of obesity later. Expectant mothers who maintain a diet that meets USDA dietary guidelines during pregnancy may be more likely to have infants and healthy birth weights, steadier growth patterns, and potentially a reduced risk of obesity later in childhood, according to a new study published in JAMA Network Open. Research involving more than 2,800 mother-child pairs across 8 echo cohort study sites suggests that following a healthy prenatal diet in line with the USDA dietary guidelines for Americans could have long-term positive effects on infant growth up to 24 months. This study found that eating a healthy diet during pregnancy was linked with a lower chance of extremely rapid infant growth, said Asamira Ferreira, MD PhD of Kaiser Permanente Northern California Division of Research. Dr. Ferreira noted that rapid growth from birth to 24 months is a strong predictor of obesity later in life. The study used two dietary measures, the Healthy Eating Index and the Empirical Dietary Inflammatory Pattern, to look at the maternal eating patterns. The Healthy Eating Index measures overall diet quality. The Empirical Dietary Inflammatory Pattern score measures how likely a diet is to cause inflammation in the body. Can standing at work have negative impact on blood pressure? A Finnish study found that prolonged standing at work had a negative impact on the research participants' 24-hour blood pressure. In contrast, spending more time sitting at work was associated with better blood pressure. The study suggests that activity behavior during working hours may be more relevant to 24-hour blood pressure than recreational physical activity. The findings were published in Medicine and Science in Sports and Exercise. In the Finnish Retirement and Aging Study conducted at the University of Turku, the physical activity of municipal employees approaching retirement age was measured using thigh-worn accelerometers during working hours, leisure time, and days off. In addition, the research participants used a portable blood pressure monitor that automatically measured their blood pressure every 30 minutes for 24 hours. Safe, non-opioid based solution for chronic abdominal pain, study finds. A research team at the University of Vienna led by medicinal chemist Markus Muttenthaler has developed a new class of oral peptide therapeutic leads for treating chronic abdominal pain. This groundbreaking innovation offers a safe non-opioid based solution for conditions such as irritable bowel syndrome and inflammatory bowel disease, which affect millions of people worldwide. The research results were recently published in the international edition of the journal Angewandte Chemie. Use of opioid is associated with various side effects and addiction risk, which has contributed to the ongoing global opioid crisis. Therefore, there is an urgent need for alternatives that minimize these risks. This new therapeutic approach targets oxytocin receptors in the gut. Study highlights early signs of Alzheimer's disease. People with Alzheimer's exhibit a loss of motor control along with cognitive decline. One of the earliest signs of this decay can be spotted in involuntary eye movements known as saccades. Researchers from École de Technologie Supérieure and Dartmouth University investigated the use of earpiece microphones to spot early signs of Alzheimer's. They presented their work at the virtual 187th meeting of the Acoustal Society of America. These quick twitches of the eyes in Alzheimer's patients are often slower, less accurate, or delayed compared to those in healthy individuals. Detecting and analyzing saccades directly requires a patient to be monitored by eye tracking equipment, which is not easily accessible for most people. Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.